1. Overview. Chapter 1. Understanding Stroke. Nearly everyone has heard of a stroke, and most people know someone who has had one. To help you better understand what a stroke really is, why strokes occur, and who is likely to have one, we asked the experts to explain. Dr. Elliot Roth is the chairman of the Department of Physical Medicine and Rehabilitation at Northwestern University and the medical director of the Patient Recovery Unit at the Rehabilitation Institute of Chicago. Dr. David Chu is a neurologist and the medical director of the Stroke Center at Houston Methodist Hospital. They are both physicians and researchers at leading hospitals in the treatment of stroke, and they answer your questions about what happens during a stroke and how to prevent one from happening again. Question 1. What is a stroke? Author's note. A stroke is a disruption of blood flow in the brain. Like the rest of our body, the brain depends on a network of blood vessels to carry oxygen and nutrients to the cells. When those vessels become blocked or damaged, part of the brain doesn't receive the oxygen it needs. When brain cells are impaired or killed, the function in the part of the body those cells control is compromised, making the body part weak, paralyzed, or uncoordinated. Because of the way the brain is organized, damage to one side of the brain affects the opposite side of the body. For example, a stroke affecting the right side of the brain may impair the use of the left arm and leg. After a stroke survivor will experience an array of effects on the mind and body, the number and severity depending on where, how much of, and how long the brain was affected. These can include physical, cognitive, and communication challenges that vary widely from person to person. A stroke is also known as a brain attack, or a cerebrovascular accident, or CVA. Strokes are not uncommon, and they can affect anyone at any age. Stroke is the fifth leading cause of death and the leading cause of adult disability in the United States, affecting nearly 800,000 people per year.
I didn't understand stroke at all when I had mine. It would have been helpful if someone had drawn a picture of the brain and showed me how the left side of the brain controls the right side of the body. Videos or visuals would have been great since I had trouble understanding words. I met many survivors who said that they didn't understand much in the hospital and were scared. I hope this book gives you some of the information I needed when I first had a stroke. David.
A tip. As the saying goes, knowledge is power. The first step in this recovery journey is a better understanding of what has occurred. By learning what has happened to the brain during a stroke, you can then have a better idea of how you can best optimize recovery. The full picture of stroke. A stroke can cause problems with movement, vision, memory, sensation, communication, eating, or thinking skills. It can impair your ability to care for yourself in many ways. Since certain parts of the brain are specialized for specific functions, a stroke in one of these areas may cause particular challenges. If the stroke has occurred in the left hemisphere of the cerebrum, you may experience right-sided weakness or sensory problems, language problems, or impaired analytical skills. If the stroke has occurred in the right hemisphere of the cerebrum, you may experience left-sided weakness or sensory problems, visual spatial problems, or impulsivity or inappropriate behavior. If the stroke has occurred in the cerebellum, you may experience coordination and balance problems or dizziness. If a stroke occurs in the brainstem, you may notice swallowing problems, vision issues, or decreased alertness. To see a visual image of the parts of the brain that I'm describing, please see the supplemental material that came with this audiobook. Question 2. What causes a stroke? Dr. Roth. A stroke is a problem that results from blood vessel disease in the brain. There are several different kinds of problems that could happen with the blood vessels. The most common type of stroke, about 85% of all strokes, is an ischemic or thrombotic stroke. This is where there's a blockage or occlusion from a clot stuck in a blood vessel that goes up to the brain or in the brain itself. Any of the brain tissue that surrounds or is supplied by that particular blood vessel is then affected and becomes either injured or sometimes permanently damaged because of the lack of oxygen, blood supply, and nutrients. The other type of stroke, which is less common, about 15% of all strokes, is a hemorrhagic stroke, or a bleed in the brain. That's when the blood actually leaves the blood vessel itself, goes into the brain tissue, and sort of pushes the brain tissue aside. In this case, the blood itself is actually pushing or damaging the neuron cells, so the nerves become affected. Any of the functions, behaviors, or activities that are controlled by that particular part of the brain are impacted and become abnormal. Author's note: while fewer people have hemorrhagic strokes, they tend to be deadlier. People having a hemorrhagic stroke are more likely to have headaches, nausea, or seizures than those with ischemic strokes, but only a brain image can tell the difference for certain. Hemorrhagic strokes may be caused by high blood pressure or weakened blood vessels, known as aneurysms or arteriovenous malformations, or AVMs. Question 3. Who is at risk for a stroke? Dr. Roth: I put stroke risk factors into 3 broad categories. The first are risk factors that can be changed with medication or medical treatment, like surgical correction of blood vessel abnormalities, taking blood thinner medication, or taking an aspirin a day. The second broad category is risk factors that can be changed with lifestyle changes. Things like controlling high blood pressure, diabetes, and cholesterol, or giving up a sedentary lifestyle, smoking, and alcohol. The third are risk factors that cannot be changed. For example, family history increases the risk of having a stroke very slightly, and there are genetic conditions that can lead to a stroke, like sickle cell disease, Fabry's disease, and CADASIL. People like to talk about those things, but you can't do much about them. Focus on the things that are changeable either through lifestyle or medicine.
I had a stroke when I was just 10 years old because I had Moyamoya disease. It is a rare condition that prevents blood from flowing freely in the brain because the blood vessels get too small. There was nothing I could have done to prevent it. But you probably don't have a 1 in a million brain disease like I had. There are many things you can do to prevent having a stroke. And for us survivors, there are many things we can do to prevent having another one. David.
A tip. I always tell my patients that feelings are information. And so it goes with anxiety, which has the power to either prevent or promote change in our lives. What is your anxiety telling you? Is it urging you to do something differently? Perhaps it's reminding you to see your specialist or get that physical you were supposed to have last year. Maybe it's begging you to eat better, drink less, start meditating, or exercise more. Or maybe it's telling you to talk to someone about your fears. When we allow anxiety to help us create positive change, we will probably have a little less anxiety in the future. Dr. Chu: there is a difference between the rate of stroke in men and the rate of stroke in women. The incidence of stroke is lower in women until around the age of menopause. So there's kind of a protective effect of being female, but once you get older, that benefit seems to go away. In fact, because women tend to survive to older ages than men on average, there are actually significantly more women who end up suffering a stroke than men. Another observation in terms of the demographics of stroke is that there is a stroke belt in the United States. That stroke belt encompasses the southeastern United States, where there is a dramatically higher rate of stroke, almost double that of the rest of the country. The reasons for that likely have to do with the known risk factors for stroke: dietary differences, the prevalence of high blood pressure, diabetes, and smoking, and some racial and ethnic differences in the rates of stroke as well. African Americans are at higher risk for stroke, nearly twice that of Caucasians. Some conditions like intracranial atherosclerosis or a hardening of the arteries in the brain are more prevalent among Hispanics and Asians. There are also more young people having strokes now than ever before, and it has to do with the prevalence of stroke risk factors. As obesity becomes more rampant, diabetes becomes more prevalent, and drug abuse becomes more widespread, you're going to see an increase in the rates of stroke. Even children, infants, and newborns can have strokes. The good news is that there's greater brain plasticity to recover in younger people, though they have to deal with the impact of a stroke for many more years of their lives.
I was a child when I had my stroke. That was good because my brain was more plastic than an adult brain. Then again, my stroke was also far worse than most adult strokes. I recovered the way I did, not just because of how plastic my brain was. It was also because of what I believed about the world. As a child, I thought people get sick and then they get better. I always believed I would get better. I had no idea that a stroke could cause a long-term disability. This belief became a self-fulfilling prophecy and kept hope alive. I hope you have the same sort of optimism I had. It may make a big difference in your recovery. David.
A tip. Core beliefs we have about ourselves and the world affect the way we think, feel, act, and recover. They have real biological effects throughout our bodies and brains. If you believe bad things always happen to me, then you'll start to look for evidence of this. This can lead to hopelessness, which then leads to high levels of stress hormones. These stress hormones can create inflammation, which prevents your body and brain from healing. Even if you are struggling today, try to modify your core belief. For example, say, there are bad things happening right now, but I also know I still have good things in my life. Then look for evidence of this. By doing so, you'll have the power to change the way you think, feel, act, and heal. Create a core belief that inspires you. Remind yourself of this belief every day. Question 4. What are the chances that stroke survivors will have another stroke at some point in their lives? Dr. Chu. The risk of stroke recurrence depends on what caused the stroke in the first place, and also which stroke risk factors that person had. There's no doubt about it. Having a stroke puts an individual in a high-risk category for a stroke recurrence. So if you take a look at overall numbers, about 10% of all patients who have had a stroke will suffer a second stroke in the first year. Now, of course, that risk can be modified greatly depending on the treatment and preventative measures that one takes. Dr. Roth. The risk of a second stroke after a first stroke depends on the type of stroke and the causes. For example, some people who've had a hemorrhagic stroke because of an abnormal blood vessel like an aneurysm will need surgery to have the aneurysm clipped or reduced. In that case, their risk of another stroke becomes much, much lower. But if it's not taken care of, obviously there's still a risk of a subsequent stroke. Similarly, if a person who's had an ischemic stroke continues to have the same risk factors that caused the stroke in the first place, like high blood pressure, diabetes, smoking, or alcohol overuse, and none of those things are addressed, then that's a problem and the risk of recurrence goes up. Author's note. At least a quarter of all stroke survivors will have another stroke in their lifetimes. You can dramatically lower your risk by knowing what caused your stroke and reducing your risk factors. However, in up to a third of strokes, the cause is unknown. These types of strokes are called cryptogenic strokes, and they can be frustrating and scary. Your doctor may be able to do further tests to determine the cause of your stroke and help you take steps to manage your risk factors to prevent a recurrent stroke. Question 5. What can someone do to prevent having a stroke or another stroke? Dr. Chu. A few decades ago, it was thought that stroke was nearly untreatable. In the course of a few decades, we've gone from that to making stroke likely the most preventable of the catastrophic diseases. One of the bedrock principles of stroke prevention in patients who've had a stroke is to aggressively treat the stroke risk factors. We know a lot about the risk factors for stroke: high blood pressure or hypertension, high cholesterol, smoking, and obesity. So if we aggressively treat the modifiable risk factors, we see that can have a tremendous impact on the chances of having a recurrent stroke. I'll give you a couple of examples of conditions that have tailored preventative measures. Patients who have a condition called atrial fibrillation or AFib, a type of irregular heartbeat or cardiac arrhythmia, are 5 times more likely to have a stroke than people their own age who don't have AFib. So this is the most important of the cardioembolic causes of stroke. Strokes that are caused by clots that form in the heart, break off, go up to the brain, and obstruct a blood vessel. AFib is a very important cause of stroke. It accounts for 15% or more of all ischemic strokes. For patients who have AFib, there's a highly effective treatment for stroke prevention called anticoagulant therapy, which helps prevent the blood from clotting. One of the major breakthroughs of the last 5 years has been the development of new oral anticoagulant medications that have, in many cases, overtaken the older Coumadin or warfarin medications as the first-line choice for preventing stroke in patients with AFib. These are drugs like Eliquis, Pradaxa, and Xarelto, and they're highly effective. We're talking about drugs that by themselves can reduce the risk of stroke by 70 to 80%. Another important cause of stroke is carotid stenosis, a blockage of the carotid artery in the neck, which is one of the major highways of blood flow to the brain. If you have a severe blockage in the carotid artery, it puts you at high risk for having a stroke. Often, people with carotid stenosis will need carotid revascularization, a kind of surgery or procedure to open up the artery. We now have both the traditional surgical technique and a procedure called carotid stenting, which has been shown in recent years to be the equivalent of surgery in terms of the effectiveness of opening up the artery and preventing future strokes. For patients who don't have AFib or carotid stenosis, often they may benefit from taking medications like aspirin or Plavix. These are blood-thinning medications, and for patients with ischemic stroke, they are often valuable in reducing the risk of a stroke recurrence. Blood pressure control is absolutely critical. This is one of the things that can most accurately determine the likelihood of someone suffering another stroke. High blood pressure is almost definitely the most important treatable risk factor for stroke from a public health standpoint. There are certain types of stroke that are directly a result of having chronic high blood pressure. For patients with intracerebral hemorrhages, the most common type of hemorrhagic stroke, high blood pressure is far and away the leading cause. High blood pressure is also the most important cause of a type of ischemic stroke called lacunar stroke. There are a number of ways that you can control blood pressure after a stroke. You can do it by eating a healthy diet and reducing salt intake, exercising or being physically active, and for a lot of people with high blood pressure, taking medication. We are recognizing more and more how important it is to keep the blood pressure optimally controlled. Not just so-so, not high normal, but optimally controlled. Takeaway points. There are 2 types of strokes. The most common is an ischemic stroke, which is caused by a clot stuck in the blood supply of the brain. 85% of strokes are ischemic. The other type is hemorrhagic stroke, which is caused by a bleed in the brain. 15% of strokes are hemorrhagic. Anyone can have a stroke at any time in his or her life. However, some people have more risk factors for stroke. You can control many of these risk factors through lifestyle choices. Eating a low-sodium, heart-healthy diet, maintaining a healthy weight, being physically active, not smoking, limiting alcohol use. Talk to your doctor to see if you need anticoagulant medications for AFib, surgery for carotid stenosis to clear the arteries to the brain, blood thinning medication, blood pressure medication, cholesterol-lowering medication, diabetes management, or better blood sugar control. Prevention is equally important before and after a stroke because many survivors remain at risk for another stroke. Controlling your blood pressure is the most important thing you can do.